What if the biggest threat to your child's smile isn't candy? What if it is something millions of loving parents do every single day, without ever realizing it? Here is the truth. Many childhood dental problems don't begin with pain. They begin quietly. No tears, no obvious warning signs. No emergency. Just tiny changes that are easy to miss. Until one day, a routine meal becomes painful, a peaceful night turns into crying, and a problem that could have been prevented suddenly requires treatment. Today, we're uncovering what pediatric dentists wish every parent knew about protecting children's teeth, the myths that lead to preventable cavities, and the everyday habits that make the biggest difference. Stay until the end, because one of the most common mistakes has almost nothing to do with sugar, and it surprises many families. Let's challenge one of the biggest myths right now. They're just baby teeth. Sounds harmless. But that belief has caused countless parents to delay dental care. Here is why that matters. Baby teeth are temporary. Their job isn't. They help children chew comfortably. They support normal speech development. They guide permanent teeth into healthier positions. They help the jaws develop properly during the years when children grow the fastest. When baby teeth are lost too early because of severe decay or infection, it can sometimes affect spacing, chewing, and future dental development. That is why pediatric dentists focus so heavily on prevention. Another misconception. If my child isn't complaining, everything must be okay. Unfortunately, dental cavities often develop long before children feel pain. And younger children may not recognize or describe discomfort until the problem becomes much more advanced. That is one reason routine dental visits matter. Not because every child has a problem, but because small problems are much easier to manage before they become painful or more complex. Pediatric dentistry isn't simply about fixing teeth. It is about helping children keep healthy teeth in the first place. Imagine this. Your child is full of energy, always smiling, always talking, always finding new reasons to laugh. Every evening, you help them brush their teeth. You try your best. They rarely complain. They eat normally. They never tell you that anything hurts. Then, every now and then, you notice them briefly touching one side of their mouth. Only for a second, then they're running off to play again. You assume it is nothing. Most parents would. Days turn into weeks. Life gets busy, school, work, family routines, everything feels completely normal, until one night. Your child wakes up crying, they're holding their cheek. Their face looks slightly swollen. The next morning, you are sitting in a pediatric dental office, asking yourself one question. How did this happen so fast? The answer is, it usually didn't. Many dental problems develop gradually. Children often adapt to discomfort. Some don't realize anything is wrong, others simply don't know how to explain what they're feeling. That is why pediatric dentists encourage preventive care instead of waiting for pain to become the first warning sign. The good news: many childhood dental problems can be identified early, when treatment is often simpler, and preserving healthy teeth is easier. Sometimes, the biggest protection isn't reacting quickly. It is recognizing the quiet signs before they become loud ones. Here is where many parents get caught off guard. They believe cavities happen overnight. They don't. Most cavities develop slowly. Plaque builds up, bacteria feed on sugars and starches left behind after eating and drinking. Those bacteria produce acids over time. Those acids weaken the outer layer of the tooth. At first, nothing seems different. Your child still smiles, still laughs, still eats. That is why early tooth decay is so easy to miss. Another problem. Many parents think brushing alone is enough. Brushing is essential, but it is only one part of protecting a child's oral health. Daily habits matter. Food choices matter. Fluoride matters. Regular dental checkups matter. And timing matters. Waiting until a child complains of pain often means the cavity has already progressed. Pain is usually a late warning sign, not the first one. The goal isn't simply treating cavities. The goal is preventing them from developing in the first place. So why are children more likely to develop cavities than many adults? There isn't just one reason. It is a combination of factors. Young children are still learning how to brush effectively. Even when they brush every day, they often miss hard-to-reach areas. Their diets may also include frequent snacks, fruit juices, flavored milk, crackers, dried fruit, or sticky foods. Many parents are surprised to learn that cavities aren't caused only by candy. Any food or drink containing carbohydrates can become fuel for cavity, causing bacteria if it remains on the teeth. Frequency matters too. Constant sipping or frequent snacking gives bacteria repeated opportunities to produce acids throughout the day. Saliva normally helps protect teeth by washing away food particles and neutralizing acids. But when teeth are exposed to sugary or starchy foods again and again, saliva has less time to do its job. Fluoride also plays an important role. It strengthens tooth enamel and helps protect against early decay. That is why pediatric dentists often recommend fluoride toothpaste in age-appropriate amounts and discuss additional fluoride exposure when needed. Every child is different. Some children naturally have a higher risk for cavities because of their eating habits, oral hygiene, medical conditions, medications that reduce saliva, or previous history of tooth decay. That is why individualized preventive care is so important. Now here is something that surprises many parents. A pediatric dental visit rarely looks the way people imagine. Forget the scary movie scenes. Forget the outdated stereotypes. Modern pediatric dentistry is designed around children. The goal isn't to frighten them. It is to help them feel safe. Many pediatric dental offices are built to reduce anxiety from the moment children walk through the door. Friendly colors, play areas, gentle communication, simple explanations, specialized equipment designed for smaller mouths. Pediatric dentists also receive additional training focused on child growth, behavior, and development. That means the appointment isn't only about teeth, it is about building trust. Helping children develop positive dental experiences early in life can influence how they feel about oral health care for years to come. Because the best dental visit is often the one that helps prevent the next dental emergency. So, what can parents actually do? Start with the basics. And stay consistent. Brush your child's teeth twice a day using fluoride toothpaste in the amount appropriate for their age. If your child is still learning to brush, remember this. Children often need help brushing far longer than many parents expect. Watching isn't always enough. Supervising and when needed, helping can make a big difference. Next, pay attention to drinking habits. Water is usually the best choice between meals. Frequent sipping of sugary drinks, juice, or other sweetened beverages can expose teeth to repeated acid attacks throughout the day. The same idea applies to snacks. It is not only what children eat, it is how often they eat. Giving teeth time to recover between meals supports the mouth's natural protective processes. Another important habit, schedule regular dental checkups. Preventive visits allow pediatric dentists to monitor development, identify small concerns early, and provide guidance tailored to your child's needs. Don't wait until something hurts. Pain usually means the problem has already progressed. If your child feels nervous about visiting the dentist, avoid using frightening words or telling stories about painful dental experiences. Instead, talk about the dentist as someone who helps keep teeth healthy and strong. Confidence often starts at home. And remember this. Healthy habits don't have to be perfect. They simply need to be consistent. Small actions, repeated every day, often have a greater impact than occasional big efforts. But before you think you've heard everything, there is one habit that quietly increases cavity risk in many families. It is incredibly common. Most parents do it with good intentions. Some dentists see it almost every single day. And once you recognize it, you may start looking at your child's daily routine very differently. Let's talk about it. Here is the reality. There isn't one single food that causes cavities. There isn't one perfect toothbrush, and there isn't one magic product that guarantees healthy teeth. Oral health is built through everyday habits, one routine, one brushing session, one healthy choice at a time. Sometimes parents feel guilty after learning their child has a cavity. But guilt doesn't protect teeth, learning does. Improving daily habits does. Working together with your pediatric dentist does. The earlier concerns are identified, the more options are often available to manage them before they become more serious. And one more thing. Every child is different. Some children may need more frequent monitoring based on their individual risk factors. That is why comparing your child to someone else's isn't always helpful. The goal isn't to have a perfect smile. The goal is to support a healthy smile that lasts as your child grows. Let's finish with something every parent should hear. Protecting your child's teeth isn't about being a perfect parent. It is about building consistent habits. Maybe you've missed a few nights of brushing. Maybe your child already has a cavity. Maybe you are wishing you had scheduled that dental visit sooner. That doesn't mean you failed. It means today is an opportunity to make a different choice. Here is something pediatric dentists see every day. Parents who ask questions. Parents who want to learn. Parents who are willing to improve. Those parents are already taking an important step toward protecting their child's oral health. Remember, healthy smiles aren't created overnight. They're built one day at a time. One brushing session. One healthy meal. One glass of water. One preventive dental visit. Those small decisions may not seem important today, but over months and years, they can make a remarkable difference. The goal isn't perfection. The goal is progress. And every positive habit you build today gives your child a stronger foundation for tomorrow. If this video helped you understand pediatric dentistry in a completely different way, consider subscribing. Every week we break down trusted pediatric health topics into simple practical information parents can actually use. No unnecessary fear, no confusing medical jargon. Just evidence-informed guidance to help families make more confident health decisions. If you have questions or experiences you'd like to share, leave a comment below. Your story might encourage another parent who is facing the same concerns. And if you know someone with a baby, toddler, or young child, share this video with them. One simple conversation today could help prevent a much bigger problem in the future. Before you go, don't miss our next video, where we'll explain the childhood oral health habits that pediatric dentists wish every family started earlier. Disclaimer: this video is for educational purposes only, and should not replace professional dental or medical advice, diagnosis, or treatment. If you have concerns about your child's oral health, tooth development, pain, injury, or dental hygiene, consult a licensed pediatric dentist or another qualified healthcare professional.